morning.
Good morning.
How are you?
Pretty good. Yeah.
It's a whole new world without a hairdresser, isn't it?
Yes.
Yes. I've been trying to comb my hair, but I've given up. I don't care what it looks like anymore. It's like, this is all it is. How are you today?
Doing all right. How are you doing?
Well, I don't know. I'll figure it out sometime before this month is over. So let me tell you how this works. I start by asking your name and for you to share any information with us that might help us understand who you are, anything that you feel comfortable sharing. So please tell us your name.
Michele Okoh.
Okay. And what will you share with us about you so we can get to know you a little bit better?
Well, I guess some basic background information on me. I'm originally from Lafayette, Louisiana. Spent some of my teen years in San Diego, California. Right now I'm working as a senior lecturing fellow with the Duke Environmental Law and Policy Clinic. I'm focusing on environmental justice, and I'm also earning my MPH as well from George Washington. This is a return for me to Duke Law. I actually went to Duke for law back in 2009. I graduated. So I left there and then I went into practice. My passion has always been the environment, but my work in a professional setting focused more on justice issues in general. So after I left law school, I went and I worked for the North Carolina Department of Justice. For 2 years, I represented the Medicaid program. And then after that, I went and I worked as a prosecutor for about, 4.5 years.
In North Carolina?
In North Carolina, yes. What used to be District 7, Nash, Wilson, and Edgecombe counties. I then opened up my own practice where I focused on representing individuals with disabilities. Specifically, I worked with a lot of Social Security claims. And then after having my practice, I decided to try to return back to the environmental realm, and that's how I ended up back at Duke.
Congratulations. Do you still have your practice?
No.
No, okay. Okay, so this chat is going to be a little different because of your expertise. So I'm going to ask you this. So how does environmental justice affect Black and Brown communities? What is the synergy between those two things?
Well, for one thing, environmental justice is inextricably tied to health. So one of the things that we kind of see, unfortunately, for every indicator, and that's really where environmental justice comes in. There are, unfortunately, when it comes down to health and disparities, that's where we see the communities most impacted, in Black and Brown communities. Unfortunately, that comes into place when we're looking at place-based pollution, where these facilities are sited, where they're permitted. But we also see it in consumer products as well. So what we're seeing now is in a lot of products that are targeted towards Black women, we also see concerns about some of the chemicals that are contained in those products. And that itself is also an environmental justice issue.
Yeah. I saw, I see these reoccurring commercials on TV about talc powder and women using for hygiene uses, and it could be linked to ovarian cancer. I thought it was very interesting because I'm like, how do you make that correlation in court that, this is what it is? Because I always wonder when you're going to sue somebody, how do you tie what's happened to you to something you've used or something that's been in your environment? So that's, I think I understand that a little bit better. But let me ask you this. So, and I'm not North Carolina, but like New York or California, Chicago, some of the more big urban cities where there's a tremendous amount of poor or homeless people of all races, not just black, brown, white, yellow, orange, every color, they're there. And when you walk along, so I've gone to Chicago 4 or 5 times in my life, and when you walk around the streets, there are certain areas where the smell of urine or trash or stuff is just so everywhere and then there's someone sitting outside with all of their possessions. How what is the justice for that? How is that addressed? Is that an economic issue? Is that a city or a county or state policy about these things, or is there something else?
Well, I would say all of the above. So when we're looking at health, can be pretty broad. We're no longer looking at health as being the absence of disease. We're really looking at well-being.
Right.
And for that, really anything that impacts quality of life impacts health. In this circuit, and then also for health, we have a tendency to focus on the ecological model. So we don't just approach things from one level. The individual level is important. The relationships that individual has with friends and family are important. The community is important. And then finally, if we go larger, right, that's when we kind of go into our policy realm, right? But all of those are important. And for each of those, you have to take each level into account and have different interventions to address the needs of people at those levels. You can't just focus on one and expect the problem to be solved.
That's very interesting. So I have been saying this for a long time, and people say I'm crazy when I say this, but the 1% could eradicate hunger and a snap of a finger. Just the 1%ers could eradicate hunger across the entire United States. But it seems like to me that we have pockets of it. You know, we have children that are going to school who, especially now that we're learning remotely, who aren't getting 3 meals a day or 2 meals a day. I think the school gives breakfast and lunch unless they do an after school program. All of these kinds of things are kind of welling themselves up together to further increase the lack of economic justice, if you will, for some groups. So when you talk about health that way, I mean, so food has to be a part of that, right? So the quality of the life you live, like, so do you have clean air, or do you have some way to make sure you're not, carbon dioxide is not in your home and all that stuff? Again, I'm assuming all these things are policy, but then in the simplest part of this, why aren't these things addressed, or why are they so difficult to address?
Some of it is in priorities. So at a policy level, issues related to health have a tendency to be underfunded. Some of it is in how we approach, implementing our laws, where there's a lot of emphasis placed on, cost-benefit analysis. And then also in some areas, for example, like when it comes to toxic regulation, where we don't really take a precautionary principle, where instead of needing things to be proven as safe, we assume they're safe until proven otherwise.
Right.
Well, that's very difficult to do. So at this point, it's a very, unfortunately, complex mix of priorities, which also kind of connects into justice, because why aren't those things a priority? Why are we putting them on the back burner? Why is it okay to prioritize certain economic interests over the health of communities? And then even as far as funding as in programs, those are not priorities. Mm-hmm. So that is a big problem. One thing I personally think is we need to pay a lot more attention to those issues. For example, I mean, racial justice is very important. And from a health perspective, we know that racism negatively impacts health.
Absolutely.
But at the same time, we're not really addressing it as a health issue. And even when we do talk about race, right, a lot of times that's not emphasized. So health equity is very important, and we have to improve health equity in this country. So, I worked as a prosecutor. So criminal justice issues are very important to me, just because of the type of work that I used to do.
And they're tied to economic situations.
They are. But I also think that whenever we're dealing with issues of racial justice, we also need to look at our laws and how they're implemented. So So when we do have laws, we have to look at legacy issues. So just because a certain product or a certain chemical is no longer being used or banned in certain uses does not mean it's not still impacting communities. That's something that I think we need to pay attention to. I think also, why is it okay for these chemicals to be in these products, and we know that certain communities are being disproportionately impacted by their presence there? Why is that okay? Why doesn't that bother anyone?
Right.
And we have to get to the point where we realize that certain lives are not expendable.
Right. That's absolutely correct. So that's a good segue to COVID, right? So this virus is absolutely running wild across the world, and its impact has been economic as well as health. So some of what I've read said that Black and brown people are more susceptible to COVID because of pre-existing conditions or what our lifestyles, whatever they've said. But why is COVID so impactful to the Black and brown communities?
Oh, well, unfortunately, and I'm frozen for some reason, but
I can still hear you though.
okay, good. Unfortunately, some of it has to do with pre-existing conditions. So we already have health disparities in those communities.
Yep.
And when it comes to COVID, if you have pre-existing conditions, right, that makes you more vulnerable to the impacts of this particular disease. Another thing is, treatment is also a relevant issue. So we already know when it comes to healthcare that whether or not our practitioners want to, the quality of healthcare differs based on race.
Right.
If you go into an ER, there's going to be a difference in the treatment that you receive based on your race. And that is also a problem. Whether or not you saying that you have COVID-19 or suspect that you have COVID-19 will actually be taken seriously. And whether or not you'll be then instead delayed in receiving your diagnosis and sent back to family members who you can expose, to a community you can expose. Absolutely. So this is an ongoing problem and is a problem on so many different levels. I think we need to have a commitment to systemic change, not just Band-Aids, in order to see a difference here.
I agree with you so much about that. And it sounds like from what I've heard from you now is that, all of this has an underlying principle, and that's economics, the ability to move in society at the same level with our white and other peers. So, whether it's criminal justice, health justice, environmental justice, it all seems like at the foundation of that is economic wealth. Would you agree to that?
Unfortunately, what we're seeing in health is kind of independent. So even someone who is educated, who is affluent, racism will impact you, and that will have a negative impact on your health. So take, for example, just everyday life, going out, going to a store, how I'll just say, as a Black woman, how I would be treated.
Right.
Going as far as my accomplishment, my degrees, and having those seen as less, treated as less. And that those constant burdens negatively impact health.
Right.
So I think economics is an important part of it. I think we need to address that desperately in this country. But I don't think that would solve the problem just itself. We have a problem of racism, and racism, whether we like to admit it or not, negatively impacts our community.
Yeah. And I think I could just say the same thing as you just said. So I have two undergraduate degrees from Central, a master's, executive master's of public administration, and I have my doctorate from East Carolina. The only one that counts is East Carolina. And the one that meant most to me were the ones at Central, because at North Carolina Central, they knew my name, they knew my family, they knew everything about me And, you know, even today, you know, they keep up with me, not just emails asking me to send them money, but, you know, just to see how I'm doing and what am I doing if the faculty or members are still there. So that's really one of those things where I think being Black or brown sometimes comes with a set of consequences that are not always helpful, even if you are able to acquire education, to be valuable to your society. You're still a Black person. And so for some reason, we've been, I guess, decided that we are inferior to the larger or the white power, white supremacy, white privilege group. Would you think that that is the case, or are there just unique circumstances where that's not the case?
I mean, I think racism is going to be a problem. It's unavoidable. Now, as far as how that works, as far as inferiority, I don't think that in itself is necessarily where the problems comes in. So I would, at least I would like to think that that hasn't weighed in on me. I don't feel inferior to anybody.
Yeah.
But there's a certain level of.
But that's your personal feeling. You don't know if the person sitting next to you, behind you, or, you know, even in your community thinks that you are inferior.
Right. Oh, no. But their attitude towards me will impact me because I'm in a situation where I'm under this constant stress, this constant burden.
Me too.
So that is going to take a toll.
Right.
When I can't.
Mm-hmm. On your health.
Oh, yes.
Mental health as well as your physical health.
Right. Mm-hmm. Which are tied to each other.
Right. I mean, I think that this is such an important conversation, Michele. I really do think you need to kind of bring this to the forefront, because while Black Lives Matter and Brown Lives Matter and all of that, you know, I tell people the story, you know, people, you know, want to say all lives matter. And I think that's absolutely true. But if you're the fire truck and you're coming down the street and you put water on houses that are not burning, and there's a house that's burning to the ground, you have to focus on the house that's burning to the ground, not the houses that are there just because you're there. People often say that analogy doesn't make sense. But to me, when you say all lives matter, it just says that the house is on fire. It does not matter. And if there's Black people, then it doesn't matter. And I find exception with that. But I think that what you are talking about is really something that needs to be further explored in a more deeper context, if you will, like to have people understand what you just said, right? Because how I see myself, you know, I grew up very poor. I grew up in the South. I was born in the North, but I grew up in the South. And for the longest time, you know, growing up in the South, the N-word, I'm old, so I'm 61, so the N-word was used constantly. So I saw myself, and I didn't feel offended when someone said that to me until I was in my 40s, that I started realizing it wasn't there. But there's still an expectation from some groups that Black people be docile or mush themselves down, not to raise their voice over or to talk over or to talk at the same time someone of another ethnicity is speaking. You find that to be true?
I do definitely find that to be true. And even the assumptions that occur. So as a Black professional, when we go to events, are we treated as though we have the same qualifications as our white counterparts?
No.
I think a lot of times the answer is no. Generally, the answer is no.
I agree.
And being in that situation is very, very stressful.
It is.
And demoralizing.
And I think the problem for me is when you can see a Black person shot down or dead from someone's knee on the neck, says something about humanity of other groups, you know, because, you know, now lots of my white friends and colleagues ask me, well, what should I do? I mean, I always come back to this in my own mind, because I really don't know how to say what I really want to say without hurting someone's feelings. But I always think we've been going through this since 1619. So here we are in 2020, and you still don't know what to do about it. I mean, what did you didn't go to school, or were you in a, you know, away from civilization? What is that? And so I kind of struggle with why people want to know what to do. Be human, treat people as human, treat people as equals, and not put labels on them, you know, like that I'm a Black woman, that I'm an angry Black woman, or that my husband is a violent Black man, or whatever it is. I think that those are the things that people really need to start looking at first, and then consider what are the policies and practices that we endorse as a society.
Mhm. And I do also think it takes a lot of humility on their part as well, because the white community has to ask themselves, why is it that I'm making certain judgments about people? Why is it that I naturally like this person more than another person?
Right.
And I think the problem is the answer to that question a lot of times is disturbing.
Yeah.
But unless it's confronted head on, unless racism is confronted head on, it's going to continue to persist.
How do you confront racism head on? Like, so people are protesting, we're seeing more diverse people, white people, black, brown, yellow, all kind of people protesting. What is addressing racism head on? What does that look like?
I think being explicit about it, talking about it explicitly. So I think the protests are very important. What I also think is vitally important and potentially even more important is are the conversations that are coming out of that, and to keep that going and not to accept that this situation is okay.
Yeah.
Because I mean, that's the thing. If we don't talk about it, if we don't address it as a problem, it's accepted as being good,
Right.
that we are in a good position.
Right.
And it allows us to ignore the problems that exist.
I agree completely. So let me ask you a question about Duke. I've been at Duke. The year that you graduated was the year that I was hired permanently. I was hired in July of 2020, July 22, 2008, because the law school had failed an audit. That's why I was hired to the law school. But my time there, I have spent mostly with the BALSA and the HALSA students, and you know, like and the black faculty. But I find myself often wondering, you know, Duke always talks a good game about diversity, but when I came to Duke, there were 8 black law students, and there was Guy Charles, Trina Jones, Jim Coleman. I believe that was it. I believe that's all that there was there, and they have increased their diversity to some degree. But why do you think that Duke does it as much as they talk about diversity and as many of things that they speak out on? Why do you think Duke is not more diverse in terms of the student population as well as the faculty and staff populations?
I think some of it probably comes into recruitment. I know for me, when I was looking at law schools, I had specifically decided I was not going to stay in the South, partially because of my experience with racism
Yeah.
being in the South. Duke was actually the only law school that I had applied to in the South, and in connection with why I decided to come to Duke, a lot of it had to do with the recruitment. So specifically, you know, when I was considering law schools, I was, like I said, Duke was the only one I applied to in the South. I was considering not being in the South.
Mm-hmm.
But I also have a son, and because of that, actually, PALS, parents attending law schools, you know, one of the representatives contacted me, talked to me about childcare in the area, really did a big effort on recruiting the things that I was interested in.
Yeah.
So I think some of it is in that area as far as recruitment. Are we as a university going to the spaces where Black and Brown people are? And then also, we do also have a history to contend with. Duke is in the South,
Yeah.
and you know, Duke is not seen as necessarily being a supportive environment for Black and Brown people.
Yep. I wrote President Price a letter, and I told him, I said, if you would ask the average Black person in Duke what they call Duke when they're not around certain groups, we call it the plantation, because like it's no matter how hard you work, it's never enough, and you're not paid enough, you know, because of who you are. The majority of people who you see cleaning up, cooking, are Black and brown, where the majority of the faculty and administrators are white and male, some white, female, and a sprinkling here or there of Black and brown, but not very much.
Mhm.
I don't think he liked it. He didn't respond to me.
Yeah. No, but I think those types of responses are important. I recently anonymously shared my experience. I would like to think that someone's going to read what I wrote and take it seriously.
Yeah.
But I think we all need to share our experiences and have that be considered. I think one of the challenges as communities is that a lot of times we keep these things to ourselves.
Yeah.
And, in a sense, we have our support system, but that allows the system to go unchallenged. It allows the system to exist in a false reality.
Yeah, absolutely. And I think that, and by and large, Duke is not unique at all. I mean, they're not, I mean, although they're in the South, you can find the same thing in the North, the West, wherever you go, you find the same desperate situation with people of mixed ethnicities. And when I mean black, brown, yellow, whatever, I mean, I think that, a lot of people were aiming at that Asian market because those students were paying full bill. They didn't get the tuition discounting, or they didn't get early decisions or whatever. So they were really the meat and potatoes of what many of these universities made their money on, and then, the endowment and things like that. But now, when you look at this, so the person that is our president has put certain guidelines about people coming in and out of the United States. What does this mean for these universities? And then if it means anything to them, what do they do to support their other ethnicities, such as black and brown students?
Definitely. And, I think one of the challenges as well is, and I hate the term, but I think it's relevant as a concern as far as tokenism, and thinking that we've got one black person, that black person is going to represent the black experience.
Exactly. I had a black faculty member at Duke University tell me that. She said every time something black comes up, they call her to come do everything. And she said, I don't represent the black community. I'm just a member of that community.
Exactly.
Well, please send me your piece so I can read it. We have about 3-4 minutes. I leave it to you to say whatever it is you wish to say. And when this video is converted, I'll send you a link to it so you can look at it and view it. If you agree, I will upload it. If you don't, we won't, or we can do it over.
Sure. Well, I would just say thank you for inviting me and talking with me and allowing me to discuss, my background and, the importance of diversity. So thank you.
You're welcome. There's one question I didn't ask you. I do want to ask you. Have you ever felt unsafe of your person or for your child? Have you ever felt afraid and just as you move about the world?
Oh, yes, definitely. And that is, I definitely have those conversations with my son to understand what it means to be a black man, and that he needs to be extra cautious.
Right.
And I've explained to him that we are less safe.
But doesn't, I mean, so I'm the same. I have 2 children. I have a 41-year-old daughter and a 21-year-old son. And we have those conversations too. But the fact that we have those conversations says something about our entire system. That you have to tell your child, when you're out and about, if you get stopped by the police, make sure you put your hands on the wheel, make sure you have your license and registration out, do all these things right, just so you can make it home. Because my son goes to a private school in Greensboro called Greensboro College. And it's 48 miles from his front door to our front door and back, and so the minute he leaves to go back to school, I start praying. And I pray until he gets there and sends me that text or call and says, Mom, I made it. And then when he's moving about throughout the Greensboro area to get something to eat or whatever it is, my fear is my God, please, please don't let anything happen to my child. And I think the same thing for my daughter, but I think because she's a little bit older, she's kind of gotten a sense of now how this thing really works. But my son, in a lot of ways, is naive about this. He thinks that, this never could happen to him. I'm like, okay, I'm sure almost every black person that died didn't think this was going to happen to them either.
Mm-hmm. Yeah, I mean, and I have the same issue with my son, not really understanding necessarily the kind of the danger that exists. I will say, you know, I was a prosecutor, and I remember a conversation I had with the law enforcement officer. And one of the things he brought up to me, and my son at this time was in middle school, maybe even still in elementary school. But, you know, he was talking to me about gangs, and he's like, okay, yeah, well, you know, your son could be in a gang and, you know, you not know it. And, you know, at the same time, I'm thinking, you know, would you be saying the same thing to, you know, my fellow white prosecutors, you know, and their sons?
Yep, absolutely.
So
And
what is it exactly about my son that makes you think that he could be in a gang?
he's black, of course, you know. He's
Yeah.
black or Latino, you know, something like that, because that's all we do is we rob and mob and kill. That's all we do. And I think that for me, what really sets me off about this is like white America, white privilege, whatever you want to call it, white supremacy, they have not looked at what they have done to populations all over the world for reasons that make no, the Native Americans, slavery, you know, the Holocaust, all of these things. You think about that and think, where is your humanity? You know, so people ask me, what should I do? I think, you know, find your humanity. You know, see people as humans and not by the color of their skin or the thickness of their lips or hips or the texture of their hair, because none of that matters. None of that matters. When I worked at Chapel Hill, UNC Chapel Hill, my office was underneath the coroner's office, and he would call me up, and he was a very, 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 very nice white man. He said to me, Rochelle, I wanted to show you something about race, right? So I'm going up there to his office. I thought he was going to give me a book or something. And he showed me a dead white person who had been dead for like 10, 11 days. They were darker than the blackest person I've ever seen in my life. And he said, this is what we have to get people to understand, is that what's on the outside is only external. What really matters is what's on you, what's on the inside of you. And I was just so profoundly shocked by that. I just said, wow, that's pretty deep right there. You know, because really the person, you know, I don't know whether they had died of violence or whether they died of, you know, natural causes, but their skin was darker than any dark person I've ever seen that's considered black. So when we attach color, hair, lips, whatever it is, these are just external characteristics, and they hold no value other than giving somebody the thought that they're better or more supreme than I am or you are. So I don't know, just a challenge. I wish you all the best, and please send me a copy of the article. I would love to read it. When this has converted, I'll send it to you. You can look at it and see. But I will tell you, these chats have been getting so much attention because people are surprised to hear Black people tell these stories. Like this is coming from like Oz or somewhere. They can't believe this is actually what we really experienced. When you get person after person after person after person say almost the exact same thing, you know, they're starting to think, well, maybe there is a problem here in America, but they just don't know what it is yet. Yep. Well, thank you so much, Michele. I appreciate
Thank you
very much. Stay safe.
Oh, I will. You too.
Bye.